I had a patient recently who was talking to her generalist OBGYN about seeing me and getting blood work done with me. And her generalist OBGYN said that there's no need to get hormonal labs drawn. And I understand where this other practitioner was coming from, but I want to talk about this a little bit because there is a reason to get hormonal labs drawn. So when I order labs for patients, we are by no means only checking hormones. There are lots of other things we want to check. We want to check for thyroid issues. We want to check for iron issues. There are all sorts of other things that could be contributing to symptoms that we're seeing. I've talked about this loads of times, but treatment should be guided based on symptoms. Labs are helpful. They're helpful to get a fuller picture, especially, like I said, when we're talking about other causes or other potential causes of symptoms that we're seeing for you. So, yeah, there are things other than hormones that we're checking. But even with hormones, it is really helpful at the very least to get a baseline. And that's what we're doing with this patient. She's starting new hormone treatment, and I want to get a baseline on her because we're starting her on patches and estrogen patches and oral progesterone. And every body absorbs the estrogen in patches differently. And some people, their body just doesn't take to it. It just doesn't really absorb the estrogen. And we don't know that unless we're keeping an eye on hormone levels. So, getting a baseline, using the patch, and then measuring later and checking that it is actually absorbing is very helpful, because if it's not, we know we need to switch to another form. And that is one of the many reasons why I still get labs done. I still recommend getting labs done. It's not 100% necessary, but I still recommend getting hormonal labs done, even though we're using symptoms to guide treatment.